Oh.
No, don't touch it. Look.
Bugs where they shouldn't be, fish hooks playing hard to get, and why pulling out large foreign objects the wrong way is a terrible idea. Today, we're answering the age-old question of to pull it out or not to pull it out. All right, let's dive right in.
I'm showing this to y'all to keep you from having to go to the doctor and pay a big old bunch of money for something so easy.
That is fine. I totally understand that. But sometimes it's really important. You know, increased risk of infection, increased risk of damage to underlying tissues. Please be careful.
Excuse me if my hand's shaking. It's been in there a while and the doggone feeling's coming back.
Likelihood this is soft tissue. It is small. You're able to control the bleeding once the bleeding does happen. But again, because these have barbs, there's a significant amount of finagling and it getting stuck and could be difficult.
What I'm going to do is hold this down like this. And on the count of 3, we're going to jerk it out. 1, 2.
Yeah, I don't 100% recommend that. When somebody comes in with a barb injury like this, that little sticky barb holds onto the tissue. Because it's a hook, sometimes it actually goes further through. You might actually be able to push it all the way through, even if it like made a puncture hole on the other side.
So this patient came in recently with a chief complaint of a new mole in the back. And I said, that's not a mole.
Is that a tick?
That's a tick.
Nice. The reason why you need to remove the tick is the increased risk of it transmitting an infectious disease to us. Sometimes there's actually something called tick paralysis. As the tick is actually having that nice meal on us, sometimes it actually causes paralysis, and then the paralysis disappears after you remove the tick.
Did you know there's a right and wrong way to remove a tick from your skin? Here I am numbing it with local anesthesia, which is optional. But the key to remove a tick is grasping it from its mouth and pulling in one motion out, trying not to leave any tick marks behind.
Sometimes the tick might get stuck, or sometimes as you pull, you might actually leave a piece of the tick in there and you will do your best to get it out. You leave a piece in, it will be okay. It'll come out like a splinter, but we will help trying to get it out. Oh!
No, don't touch it. Look.
Oh my God.
Hang on, don't take it. Oh.
Wow, that is a good size splinter. There is a very good reason why sometimes we say, don't pull it out, let us take care of it, because of the increased risk of some other problem now happening. Because now, a lot of times somebody will come to the emergency department and ask us to try to get this out, and we will try, but it will be significantly difficult because now we have to dig a little bit and try to get this out.
Go back.
Oh gosh, what's happening? Sometimes we can use an x-ray. It might have the ability to show up on an x-ray, maybe not. We might be able to feel it with our tools, but again, the tissue wants to seal back up. So if you saw the hole was bigger when the stick was in there versus now it's a lot smaller because it contracts around it. Oh.
It just opens up a tunnel inside you.
So really interesting. I want you guys to see, like, there are people who've, discussed or comment and say bullets don't change trajectory, they don't move. No, they definitely potentially can change direction. I've seen it bounce around and hit things and change direction, come out 90 degrees the other direction.
Just trying to imagine that.
Yeah.
Oh my God.
Because to think about that in your body of just this tunnel opening up through your torso and then collapsing again.
It leaves big holes in our bodies. But what's really interesting is when people end up getting GSWs, sometimes the bullets don't go all the way through and they get stuck in the body. Don't go digging your own body trying to get it out. Sometimes they are quite superficial and they're just there and you can pop it like a pimple. That's probably okay.
Good. I'm just looking at the lid here.
That. So it looks like there's an abnormal placement of an eyelash that's causing significant amount of irritation to the eye itself. We call that injection when the vessels are all irritated like that. And even the glossiness of it is not related to the tears. It's related to something called chemosis.
That is not an eyelash. That's a hair.
Hair versus eyelash, it probably has to do with the size, the density, and how thick it is. This would be something that you'd have to be pretty careful of trying to do on your own. You increase the risk of causing more damage to your eye. But if you're able to see it and you have sterilized tools, you could potentially try very easily to grab it out. If it's not easy, that's when you need to have somebody else's hands do this.
Are you done? I think that might be a poisonous stinger. No.
Honey.
Look at that. You can see the stinger.
That's so sad.
Of what I know, when we get stung, the bee disappears and we're left with the stinger there. So that stinger has that bulb on the end, and if you squeeze it, you inject more venom in, which causes the pain.
Somebody to lawn mow the grass. Y'all don't do it. Now it's done.
Yeah,
You're trying to do.
He's gonna die.
No.
Oh, get him out. There we go. Oh, damn.
Hopefully, if you do have an allergy, you do carry an EpiPen around with you. If you don't, please make sure that you discuss it with a healthcare provider and get an EpiPen.
Life hack.
Oh, please don't do anything bad. Oh, what happened? A tooth come off? Oh. Ah, if this is real, those first 2 teeth just got snapped in half. Sometimes a dentist could potentially repair them versus do they need to bond them and put like a veneer piece on. Now, the one to our right, his left central incisor got pulled out pretty good, and probably you can see some redness to it. So you're probably seeing some pulp. It's going to be quite painful. People will come to the emergency department with this issue, and we end up having like an emergent dental kit where we mix a couple different epoxies together to cover this up before you can get into the dentist. Usually within 24 hours, a dentist can get you in.
Doesn't look like much. Translucent blob of goo.
Oh my gosh, I grew up as a kid and these little things were just floating around in the water. Get out of the water, no thank you.
So the plan is I'm gonna try out a new remedy for box jellyfish stings, but the only way to do it is to actually intentionally sting yourself, and that's what I'm gonna do next.
Box jellyfish stings are awful and uncomfortable. What do? You do not pee on your friend. You get out of the scenario, you call for help. You're definitely gonna maybe need to go to the hospital if somebody's having chest pain, shortness of breath, or unconscious.
Time to give the test remedy a try. You can really feel it building up. Yeah. All right. The new solution isn't working as well as I'd hoped.
How do you get things to stop? So acetic acid, typically around 30 seconds or so. If that's not available, you can use salt water, like the ocean water. Don't use fresh water, it actually makes it worse. Try not to move the arm too much, that will make it worse as well.
So he said that he was just scratching it and he felt it like inside.
Crawling
so,
around.
Yeah.
Oh my gosh, wow.
Oh my gosh, go get it out of there.
Like it's like potato chips or something.
Yes.
You know, the little bug legs. And I get nothing. And I have to go back in for more pieces.
Foreign body in the ear, insects, sometimes they're alive, sometimes they're dead. This actually does happen and come to the emergency department very often. We might be at home and a bug flies right in the ear, just a weird chance, or sleeping on the ground or sleeping on the bed and they get in there, causing a lot of distress to ourselves. Sometimes you can use like water in there to like kind of drown the bug. Sometimes you can use like a gel, like a lidocaine gel, so it at least numbs the ear canal as well. To pull it out or not to pull it out, I think this is a great idea. This is very common to things that we have to deal with on a daily basis in our own personal lives. And if you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.